All of the following are secondary causes of nephrotic syndrome except option A, measles, option B, syphilis, option C, toxoplasmosis, option D, malaria. The answer is option A, measles. Secondary causes of nephrotic syndrome are endocarditis, hepatitis B, HIV, malaria, syphilis and toxoplasmosis. Which one of the following disease caused by bacteria? Option A, smallpox, option B, mumps, option C, tuberculosis, option D, rabies. The answer is option C, tuberculosis. Next question. Neonate shows yellow discoloration on third day of life. The nurse can suspect it is a option A, pathological jaundice, option B, bilirubin encephalopathy, option C, physiological jaundice, option D, none of them. The answer is option C, physiological jaundice. Newborn immature level often can remove bilirubin quickly, causing an excess of bilirubin in the body. Jaundice due to this normal newborn condition is called physiological jaundice. It appears on second or third day of life. Pathological jaundice is the most serious type of jaundice. It occurs within 24 hours after birth and is characterized by rapid rise in bilirubin level. Most often cause of pathological jaundice are blood incompatibility or liver disease. Which splint used to correct cleft foot? Option A, Thomas splint, option B, plain splint, option C, Dennis Brown bar splint, option D, straight splint. The answer is Dennis Brown bar splint. Projectile vomiting is a characteristic feature of option A, pyloric stenosis, option B, intestinal perforation, option C, diverticulum, option D, intestinal obstruction. The answer is option A, pyloric stenosis. Abnormal connection between trachea and esophagus is option A, tracheoesophageal fistula, option B, diverticulum, option C, anal atresia, option D, stomach ulcer. The answer is option A, tracheoesophageal fistula. Which signs and symptoms would the nurse expect the toddler diagnosed with a cyanotic cardiovascular defect? Option A, buccal and peripheral cyanosis, option B, clubbing of the fingers and barrel chest, option C, increased urine output and tended tissue turgor, option D, periorbital or facial edema and jugular vein distension. The answer is option D, periorbital or facial edema and jugular vein distension. Which signs and symptoms would the nurse expect to assess a 9-year-old child diagnosed with absent suture? Option A, generalized stiffness of the muscle, option B, blank facial expression for 5 to 10 seconds, option C, unexplained feeling for fear, option D, teeth grinding or chewing. The answer is option B, blank facial expression for 5 to 10 seconds. Absent seizure have no muscle activity except eye fluttering with blank facial expression for a short time. The nurse caring for a 8-year-old child diagnosed with head injury assess purposeless movement with painful stimuli. 2 hours later, the child assumes decorticate posturing with painful stimuli. Which action should the nurse implement first? The options are: option A, reassess the client in another 2 hours. Option B, document the finding in the chart. Option C, inform to doctor. Option D, turn and position the client on the side. The answer is option C, inform to doctor. Decorticate posturing indicate worsening of patient condition due to increased intracranial pressure. Surgery done to repair cleft lip is: option A, meningioplasty. Option B, tympanoplasty. Option C, mandibuloplasty. Option D, chelioplasty. The answer is option D, chelioplasty. Surgery done to repair cleft palate. Option A, meningioplasty. Option B, staphylography. Option C, chelioplasty. Option D, rhinoplasty. The answer is option B, staphylography. A 13-year-old adolescent diagnosed with epilepsy is prescribed phenytoin. Which instruction should the nurse discuss with parents? Option A, perform daily phenytoin level. Option B, explain importance of dental care. Option C, do not drive or operate heavy machine. Option D, be sure to eat prior to taking medication. The answer is option B, explain importance of dental care. Phenytoin causes gingival hyperplasia, therefore patient must brush teeth and see the dentist regularly. At the time of birth, infant is covered with white matter called: option A, lanugo. Option B, vernix. Option C, decida. Option D, lochia rubra. The answer is option B, vernix. Which signs and symptoms would the nurse assess for a 8-year-old child who is admitted with diagnosis of Sprungs disease? Option A, stool that look like jelly. Option B, ribbon-like foul-smelling stool. Option C, loose running stool with undigested particle. Option D, nausea, vomiting and abdominal pain. The answer is option B, ribbon-like foul-smelling stool. In Sprungs disease, the area of colon without ganglion does not have peristalsis. Therefore, the stool is narrow. Foul smell due to accumulation of stool for long time in the colon. The most serious complication of meningitis in young children. Option A, peripheral circulatory collapse. Option B, epilepsy. Option C, growth retardation. Option D, communicating hydrocephalus. The answer is option A, peripheral circulatory collapse. Neisseria meningitis enter the bloodstream and multiply. It lead to meningococcal septicemia. Meningococcal septicemia characterized by widespread vascular injury with evidence of circulatory collapse and disseminated intravascular coagulation or DIC.